Okay, this is the diseases and conditions of the digestive system, part 2. We're going to start off with cirrhosis of the liver. This is a chronic, irreversible, degenerative disease of the liver. It's often caused by chronic alcoholism. It's a consequence of repeated trauma inflicted onto hepatic tissue by toxins, infectious agents, metabolic diseases, and circulatory disorders. The hepatic cells become necrotic, causing a change in liver structure that impairs the flow of blood and lymph. Viral hepatitis. This is an inflammation or swelling of the liver due to infection with the hepatitis viruses A, B, C, D, E, or G. Signs and symptoms: the person is tired, there's poor appetite, fever, nausea, urine can become darker, and jaundice. Hepatitis A. This is a picornavirus. Transmission is via the oral fecal route. Okay. Hepatitis B, this is a hepatinovirus. Transmission is by direct contact with body fluids such as blood, saliva, semen, etc. When you develop anti-hepatitis B surface antigen, this demonstrates resolution of the hepatitis B virus infection and provides prolonged immunity. People who don't develop anti-HBs or hepatitis B surface antibody, they become chronic HBV carriers. Okay. Hepatitis C, this is a flavivirus. This is a blood-borne disease as well. It's transmitted by blood and body fluids, and 80% become carriers and are asymptomatic for the first 10 to 20 years. Okay, and they talk about causes here. Cholelithiasis. This is the formation or presence of stone-like masses called gallstones within the gallbladder. Any factors that cause the bile to become overladen with cholesterol may increase the likelihood of the formation of cholesterol-based gallstones. Now, cholecystitis is an acute or chronic inflammation of the gallbladder. It's usually associated with obstruction of the cystic duct from cholelithiasis. Pancreatitis is an inflammation of the pancreas. It's most commonly caused by either alcohol toxicity or gallstones. Malabsorption syndrome. Malabsorption, which presents most commonly as chronic diarrhea, is characterized by defective absorption of fat and soluble vitamins, proteins, carbohydrates, electrolytes, and minerals, and water. Malabsorption syndrome is a clinical term that encompasses defects occurring during the digestion and absorption of food nutrients by the gastrointestinal tract. Celiac disease is also known as gluten-induced enteropathy. They have an intolerance to gluten, specifically the gliadin fraction. Okay. Now, right here, this is normal, and these are the little villi. These line the small intestine and increase the surface area for the absorption of the nutrients. See, like little fingers? Well, this is celiac disease. So the inflammation often leads to atrophy or flattening of the villi, thereby diminishing the absorptive capacity. And so this is caused by an immune reaction to the gliadin fraction of gluten. A trigger for celiac disease is a subtype of gluten molecule called prolamines. Common prolamines are gliadin from wheat, hordein from barley, and secalin from rye. Okay. Now the good news with a celiac, for all the problems that it causes, when you get off the gluten, the symptoms go away. It's a real easy fix. Anorexia nervosa. This is an eating disorder. It's self-imposed starvation. Patients have a distorted body image. They have this overwhelming compulsion to be thin. They can just never be thin enough. Bulimia is a behavioral disorder. There are recurring episodes of binge eating followed by self-induced vomiting. And that's it. Thank you.